Hello, today we are going to talk about Lyme disease. Lyme disease is caused by a spirochete, Borrelia burgdorferi, and is spread by ticks. Early features will appear within 30 days after the tick bite. One of the main symptoms is erythema migrans, which is a bull's eye rash, typically at the site of the tick bite. It can develop as soon as possible, but it typically develops within 1 to 4 weeks after the initial bite. Usually, the rash is painless and it's more than 5 centimeters in diameter and slowly increases in size. It's present in almost 80% of the patients who had a tick bite. Other systemic features include headache, lethargy, arthralgia, and fever. Later, after 30 days after the tick bite, you can get cardiovascular complications such as heart block, peri or myocarditis, and neurological complications such as facial nerve palsy, radicular pain, or meningitis. Investigations for Lyme disease. NICE guidelines recommend that Lyme disease can be diagnosed clinically if erythema migrans is present and is therefore an indication to start antibiotics. If there is no erythema migrans, enzyme-linked immunosorbent assay or ELISA antibodies to Borrelia burgdorferi are the first-line test. If that is negative and the Lyme disease is still suspected in people tested within 4 weeks, then you can repeat the ELISA test in 4 to 6 weeks. If the test is still negative, then and you're still suspecting Lyme disease, then you have to do an immunoblot test. Management of asymptomatic tick bites. Tick bites can be relatively common presentation to GP practices and outpatient department and can cause significant anxiety in the patients. If the tick is still present, the best way to remove is using a fine-tipped tweezers, grasping the tick as close to the skin as possible and pulling upwards firmly. The area should be washed following the tick removal with soap and running water. NICE guidelines does not recommend routine antibiotic treatments to patients who are asymptomatic. Management of suspected or confirmed Lyme disease. Doxycycline if early disease,